The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, thank you for joining us this afternoon to learn about the status of Medicaid expansion in Ohio and what you as an advocate can do to ensure our legislators make the right decision. Just a few housekeeping things. If you're having any technical difficulties with the webinar software, you can log on to our home page of our website at www.uchanohio.org to view the PowerPoint. I will also be sending a copy of the PowerPoint in a follow-up email either later today or tomorrow afternoon. Extending health coverage to over 275,000 Ohioans is a historic opportunity that we can't miss out on. We got to do everything we can to make this a reality in Ohio. Unfortunately, most of our state legislators have been uncooperative with this effort. Now it's time to pull out all the stops. We can't afford to forego the millions in federal money that will make our economy and communities stronger. So at any point during this webinar, please submit any questions you have in the questions box in the GoToWebinar toolbar. If you don't see that toolbar, there should be a little red arrow on the top right-hand corner of your screen that minimizes and maximizes that toolbar. So if you don't see the toolbar, click that. It should expand it. Then you can type out your questions. Submit them at any point throughout the presentation, and we will take some time at the end of the PowerPoint to answer any of those questions. Today you'll be hearing from Kathy Levine, co-chair of Ohio Consumers for Health Coverage and executive director of UHCAN Ohio. You will also hear from Deb Steele, UHCAN Ohio's statewide advocacy coordinator. I'm Melissa Chenault, UHCAN Ohio's communications manager, and I really want to thank both you, Kathy, and Deb for taking time out of your day to present today.
You're welcome, Melissa.
Thank you. So to kind of wrap up on what we're going to cover today, we're going to go over, give you some background on Medicaid expansion, go over some of the benefits and consequences of not doing the expansion, what the status is in the legislature, and then Deb is going to talk about some of the actions advocates can take to help make this a reality in Ohio. And just remember, if you're having any technical difficulties, you can access the PowerPoint on our website at uchanohio.org, and I'll be sending a follow-up email with the PowerPoint as well later today or early tomorrow. So first off, I'd like to take a quick poll. I know a lot of people on the phone have already been really engaged in this issue, and I just want to get a sense of what actions you have already taken to help make Medicaid expansion a part of the reality that it is here in Ohio. So have maybe you called or visited your legislator already? Have you wrote a letter to the editor? Have you attended an event, maybe the rally where we had over 2,500 advocates at the State House? Maybe you were at the Circle for Coverage. Maybe you attended one of the community forums that we were involved in Westerville, Grove City, or Zanesville. Maybe you've helped somebody share their story with media at a different event, or maybe you've done something else. If you have, click Other and then submit your answer of what you've done otherwise in these couple things in the questions box, and that'll just give us a great idea of the dedication and things that advocates in Ohio have done to make Medicaid expansion a reality. Seems like a bulk of you have called or visited your legislator. That's really great. You have lots of avenues to do that. We can surely help you set up a visit if you haven't done so already. And we also will be having a call-in day again, as we've done all through the winter and into the spring, this Thursday. And you should see an email coming out later this week about that. So I will close that poll, and I'll share the results just so you guys get a clue into what everyone said. Thank you for that, for taking time to do that. And with that, I'm going to pass it over to Kathy, who's going to start us off with a background and kind of what the status is in the legislature. Kathy?
Thank you, Alyssa. So as everybody in the call hopefully knows, the governor proposed the Medicaid expansion, and it's received unprecedented support from very diverse stakeholders, but it's still facing serious opposition in the Ohio General Assembly. So what I'd like to do first, for those of you, next slide please, for those of you who are doing legislative visits, giving you an easy way to talk to a legislator who may, despite being involved in this conversation, not know what Medicaid really is. Because most legislators have very weak or no background in the Medicaid program. So Medicaid is a federal state program that provides comprehensive health coverage to certain low-income individuals. Now, the important thing to note is that it covers only certain groups. And in Ohio, it covers kids, pregnant women, parents, or guardians of minor children, people who are totally disabled, and older adults needing long-term care. Now, if you are a low-income adult who isn't in one of these categories, no matter how bad your chronic conditions are, if you haven't been found totally disabled, you are not eligible for Medicaid. So parents whose kids turn 19, they lose their Medicaid. And obviously adults without children are not eligible for Medicaid unless they meet another category. Next slide. Now, the Affordable Care Act, when it was passed in 2010, was designed to fill coverage gaps in the United States and do as little disruption to the coverage that already exists. So if you have good employer coverage already, this should not disrupt your employer-based coverage. But when looking at who's uninsured, the bulk of the people who are uninsured tend to have lower incomes than people with insurance. So the Affordable Care Act used two strategies to expand coverage. One is to expand Medicaid to all low-income adults under the age of under 138% of the federal poverty level. So no longer will you have to fit into one of those categories I just spoke about. All adults are going to be eligible. The Supreme Court, when it made its decision upholding the constitutionality of the Affordable Care Act, removed the penalty that was in the act that would be imposed on states that fail to implement the Medicaid expansion. Therefore, states are making decisions. Some states are considering it optional and are opting out of the Medicaid expansion. In Ohio, our governor, Kasich, decided right after the Supreme Court decision that he would take his time to evaluate the pros and cons of the Medicaid expansion and make the decision in the context of the state budget. When he announced his state budget on February 4th, 2013, the Medicaid expansion was an integral part of his state budget. In doing so, he joined 8 other Republican governors who have decided to expand Medicaid. So if the expansion goes into effect, who would be covered? This chart shows you what in 2013 what 138% of the federal poverty level is on an annual basis, a monthly basis, and an hourly basis. So an individual with no spouse or dependents has a family size of 1. You know, a single mom with 2 kids is a family size of 3. And you can look across and see what the hourly, monthly, and annual wage is. So again, the Affordable Care Act expands coverage to all people under 65 with incomes below 138% of the federal poverty level, and that's a very diverse group of people. It's kids right out of college or, you know, who left school and are getting entry-level jobs. Sorry, I'm having technical, there we go. It can be people who get laid off from work in their 50s and 60s and can't find another job and are living on a low income. It's a lot of people who are working in the food service industry, who are working in adult daycare, in child care, working in jobs making less than $8 to $15 an hour, depending on their family size. So the bulk of the people are working but not getting job-based coverage. Next. So it's important to understand who will pay for the Medicaid expansion. As I said, Medicaid is a state-federal program, and Ohio has its own matching rate with the federal government. In 2013, as the chart on the left shows, Ohio would pay 36.42 cents on the dollar, and the feds pay the rest, almost 64% of the cost of Medicaid. Now, if we were to use this formula, the regular Medicaid match, to do the expansion, it would cost the state hundreds of millions of dollars. However, the expanded population, the newly eligible, are being paid for 100% by the federal government. Ohio pays 0 for the first 3 years. In 2017, Ohio pays 5%, then 6%, 7%, and then 10% on an indefinite basis. It has been determined that by the Health Policy Institute of Ohio, in a study that you can find on their website, that even when Ohio is paying 10%, the new revenues that come into the state from added business activity, from the taxes on providers from the newly eligible population, and other generated revenue, such as income tax payments from people who get jobs due to the expansion, will put Ohio even. It won't cost us an additional 10% of the expansion in our budget. We will generate enough revenue to cover that 10%. So the benefits of the Medicaid expansion are that it boosts our economy. It will create jobs by bringing in at least $13 billion over the first six years of the expansion. That will necessitate new jobs in the healthcare sector. There's an estimate that it would create as many as 30,000 new jobs over 6 years. And of course, it promotes healthier Ohioans. The consequences of not expanding Medicaid cannot be understated. First of all, over 500,000 Ohioans will remain uninsured. And for those who have incomes below 100% of federal poverty level, there's no other option. People above 100% of poverty level can go to the health exchange, although even with the tax subsidies, for people between 100 and 138% of poverty level, the cost sharing may be unaffordable. But for people below 100%, they don't even have the option of going to the exchange and getting tax subsidies. They will be where they are now, uninsured, and delaying and avoiding necessary preventative care. We also lose $13 billion at least in federal funds over the first 6 years. That's a huge loss of revenue to the state. It also leaves a $404 million hole in the budget that the governor proposed. Next. So now let's look at Ohio's budget process from the lens of the Medicaid expansion. The governor's budget was introduced on February 4th and has been considered by the Ohio House of Representatives. The Ohio House of Representatives passed a revised budget in which they removed the Medicaid expansion but passed an amendment to work on the Medicaid expansion. Now the Ohio Senate is considering the House version of the budget, and they could restore the original Medicaid expansion, do a variation on it, or do nothing. When the Senate is done playing with the House budget, then conference committee made up of people from both the House and Senate resolves all the differences between the House and Senate versions so that they can present a single unified budget to the governor, and the governor is supposed to sign the budget by June 30th of 2013. So that's the budget process. The status of the Medicaid expansion right now is in it's in great peril, but all is not lost, which is why our message to you today is that people are going to need to step up efforts to support the Medicaid expansion. The House, as you probably know, nearly removed it, and in the final hour added an amendment that would consider, introduced by Representative Sears, that would consider the Medicaid expansion in the context of health reform outside of the budget process. The amendment allowed the Senate to continue the conversation because the Senate leadership made it clear that if the Medicaid expansion were not in the House budget at all, they were not going to put it back in. But because of this amendment, they've continued the conversation. So testimony is continuing on the budget in the Senate. People go to the Senate and present the same or revised testimony that they presented in the House because it's a whole new committee process. Senator Burke has been appointed to head a committee to look at the Medicaid expansion outside of the budget. And he has created a list of bullets that his committee will consider. His process will combine Medicaid expansion with Medicaid reform, and that has some advantages and disadvantages to it without going into all the details. One benefit of this process is that by combining with Medicaid reform, it gives Republicans a way to sell the Medicaid expansion to its own caucus members. One negative feature of this is that it could lead to delays past, that should say 2014, January of 2014. Keep in mind that the Medicaid expansion is supposed to go into effect January of 2014, just a few months from now. If this process of deliberation goes too long, we may not have the Medicaid expansion up and running in January 14. That means that all those uninsured people will be delaying care even longer. It also means that we lose, for every day we fail to do the Medicaid expansion, that 100% contribution from the federal government is lost to us forever. We don't get it back at the back end. That money is available from January 1 of 2014 till December 31st of 2016. Another downside of this combination with Medicaid reform is that when they talk about Medicaid reform, they're considering punitive actions against consumers, such as work requirements or co-pays, and that's a great concern. So let's take a look at some of the current, I'm sorry. I looked at the wrong next slide. Another conversation that's been going on in the House and the Senate is that the Republicans, some of the Republicans, want to come up with an alternative to a straight Medicaid expansion. During the House process, people kept talking about Plan B, and now they're just talking about alternatives. That alternative to doing the straight Medicaid expansion, which is done by the administration once they have authorization from the legislature with just a piece of paper, is to seek a waiver from the federal government to alter the terms of the Medicaid expansion. Arkansas's legislature, which was divided on the Medicaid expansion, just authorized going for a waiver. And that's what's under discussion in Ohio right now. And the waiver from the federal government, it's the Center for Medicaid and Medicare Services, would use federal funds to purchase private insurance in the exchange. So in other words, you draw down that Medicaid, that 100% Medicaid match, but you take those dollars and instead of buying people into the Medicaid managed care plans like other Medicaid recipients, they take those federal dollars to the health care exchange and buy private insurance in the health exchange. Now, in order for the federal government to permit this, this would have to be shown to be cost effective. So if it costs like twice as much as going through the Medicaid managed care plans, the federal government is unlikely to allow it. But given that the exchange is anticipated to have in Ohio a number of plans with a wide range of products, our administration thinks it's feasible to buy people into the exchange, particularly people above 100% of poverty level. So one issue is going to be is whether the waiver is going to seek to buy people into the exchange who are simply above between 100% and 138% of the federal poverty level, but letting the people below 100% of poverty get the comprehensive coverage and care management services that are provided in the Medicaid managed care plans. But we don't know what the legislators are considering. They also want to increase what they call personal responsibility. We don't know what that looks like. And the Kasich administration had worked out certain parameters with CMS, but the Republican caucus rejected that in the House. So let's take a look now at some of the opposition arguments that we're hearing right now. And the opposition arguments against the Medicaid expansion have changed over time. And if you saw yesterday's Columbus Dispatch editorial, the editorial was pretty sharp in suggesting that there really aren't sound arguments against the Medicaid expansion. But what we're hearing now is Medicaid is a broken system. We shouldn't be expanding a broken system. We need to reform it. And when asked for details, legislators say that they want to see less fraud in the program. Now, week before last, or last week, Medicaid Director John McCarthy testified in the Senate committee as to the tremendous strides Ohio has made in rooting out provider fraud. And Ohio's been lauded for its work on fraud prevention. They're also talking about more personal responsibility. And by personal responsibility, they're talking about cost sharing and possibly punitive measures for people who don't act a certain way. So as I said before, this will give cover to Republicans to vote for the Medicaid expansion, but consumer advocates are very concerned about what kinds of conditions they may want to impose. And if they are punitive, CMS may not approve them, in which case we won't have a Medicaid expansion. So another opposition argument is that we shouldn't, it's an ideological one, that we shouldn't be expanding a public program. We should use the public funds to buy private insurance. The problem with this is that the private insurance have to meet the Medicaid standards for the expansion population, or else add a wraparound of coverage to make up for what's missing in the exchange plans that is required by the Medicaid law. And that gets very bureaucratically difficult to administer, and it's probably not going to be cost effective down the road. There's a reason why premium assistance in the Medicaid program has not been much of a success around the country. It ends up being not cost effective and also a nightmare to administer. So personal responsibility, when they talk about personal responsibility, House members have talked about, at least in the House, they talked about a work or job training requirement, mandatory drug testing, co-pays. And the problem with co-pays, and this is very well documented in the literature, and we'll have to pull out our old papers on co-pays if this comes up, they discourage people from seeking the right care at the right time and place. And Medicaid managed care plans are now using evidence-based methods to engage consumers in their health care. That's personal responsibility for consumers to learn to be more active participants in their own health. So my question to all of you on the phone is, what do you know about the barriers that low-income people face in seeking health care or taking care of their health? And that's why I put this question here. Do you have anything to teach lawmakers on the subject of personal responsibility within the context of the Medicaid expansion population?
Okay, thank you, Kathy.
Thank you.
Before we transition to hear action steps advocates can take, I just want to remind everyone to submit your questions in the toolbar on the right-hand side of the screen. Maybe you have a question about the editorial in the dispatch or something Kathy said about the status of Medicaid expansion in the Senate. Or maybe you just want to share something with everyone on the phone. Feel free to put that in the questions box, and after Deb goes through some of the things that you can do to get involved, we'll take some of those questions.
Alyssa? I want to add one thing to everything I've said.
Okay.
I explained that Senator Burke is going to chair a committee that continues the House process of looking at the Medicaid expansion outside the budget. To me and other supporters, that doesn't mean that the Medicaid expansion within the budget is dead. It's not dead until the governor signs the budget on June 30th, until a budget is passed without it. And, you know, the Senate and House are facing increasing pressures because some of the things they want to do are not going to be approved by the federal government. They're receiving a lot of pressure from the diverse supporters of the Medicaid expansion. So people on the phone should not sit on their hands. We're going to talk about action steps. If we can increase the heat, the passion by proponents of the expansion, we may be able to get it back into the House, or at least get a process that will get us some Medicaid expansion in January of 2014. That's all.
Okay, thanks for that. Deb, do you want to go ahead with what action steps advocates can take?
All right. Thanks, everybody, for joining us, and thank you to Kathy for walking us through sort of the policy pieces. And Kathy's absolutely right. We should not let up the pressure at all. The amendment that left the House is something, and it wouldn't have happened without the grassroots pressure that our House representatives heard. So soon we're going to be driving some calls to senators. So that's the first thing here, Medicaid Expansion Call-In Day. And as always, in a concerted effort starting May 6th, letters to the editor. Always good to respond to an article, and we mean even your local community papers, your This Week Westerville or something like that. People tend to read the This Week's page to page. And this article you're seeing here ran yesterday, just talking about how the funds are important for our state budget. So that would be a great example of a letter to submit saying, responding to this article that ran yesterday, and I absolutely agree, we need Medicaid expansion, ideally in the state budget process. Another thing we talked about was talking about people's personal stories. So Medicaid expansion is a great win for the health of our state and makes economic sense. But what helps punch through some of the charts and numbers that we need to pay attention to is just someone's personal story, talking about I'm working part-time, I have this health condition, or I'm working full-time, whatever the situation is, but somebody sharing their personal situation really helps keep the pressure on our lawmakers, and ideally that person talking to their legislator saying, you know, this makes all the economic sense in the world and I need it, really helps us drive home the point. So that takes a good relationship. So if you have friends and family who are needing Medicaid expansion, we need those folks to get in touch with us, and we'll walk them through how we can talk to their legislator or things like that. So visiting legislators, moving right on to the next one. You know, at minimum, make sure your legislator hears you by the phone call. But second to that, speaking to your legislator, focusing on senators now. We simply reject that this is dead. It's not dead. If somebody has put that word out there, it's wrong. This is important for our state, and we need you telling your elected official, get this done as soon as possible, and the soonest way possible would be reintroducing into the state budget process. We'll see some photos later, but something else we can do is a community forum. So this is a way to gather folks to talk about the issue. We've done these in churches, other things like that. So this is Westerville, Zanesville, and Grove City. And this is a panel of experts or stakeholders, maybe a sheriff, somebody working in the mental health community, and always somebody's personal story, again, helps drive home the point, where we gather, talk about the issue, keep ourselves charged up, and we can invite elected officials to these events as well to continue to keep the pressure on. So community forums are something we can keep doing, but we need a lot of grassroots support to get that done. So if that's something your church might be interested in hosting us, let me know, and we could set something up. And I'd also be reaching back to know if there's anybody in your church who would share their personal story at such a forum. A smaller effort you could do, but also still important, would be organizing a house party to talk about Medicaid expansion. You could replay some or all of this webinar, because there is a lot of information in this issue. But at the end of the day, it's going to be educated folks taking action, and this webinar is one tool to help people get educated. And the last thing we're looking towards doing is regional rallies across the state. So think about hosting a house party before May 20th and building up to our regional action. Here in Franklin County we'll do one, but also across the state. I'm hoping 5 or 7 cities across the state jump in all in the same day, gathering at a high visibility location to keep the pressure up, because we did this well a few Thursdays ago at the State House. Alyssa said we had 2,500 people there, and that was just with about 4 days notice. So we're hoping on May 20th, which is a Monday, probably about noon, lunchtime, trying to have folks gather, whether it's 30 people in Worcester or 300 people in Columbus, all of us gathering to keep that pressure up, because this is the right thing for our state to do, and sometimes elected officials don't do anything we don't make them do. So any way we can keep the pressure up for them on this good issue is what the direction of the May 20th rallies are. So
Thanks, Deb.
Yep, that's the quick run-through of actions folks can take, and Kathy's absolutely right. Do not be discouraged. This issue is alive and well.
One thing that both Deb and Kathy mentioned was the importance of stories and how important it is for the media and legislators to put a face to the thousands of Ohioans that this will benefit. So one poll we want to take now is, do you know someone who will benefit from Medicaid expansion? So your choices are yes, and that you'll work with them to help them share their story, or yes, you do, but maybe you need a little help getting them to feel confident, know how to identify what a good story is. Just click that answer. And maybe you don't know anyone, and that's fine too. But we just want to help get you all the help you need to help anyone who has a story be able to share that, because it really, really does make a big difference. Give you a few more seconds to take that poll. Okay, it looks like 57% of you said that you do know someone and you'll work with them to help share their story. That's really great, and if you need any help along the way, feel free to reach out to any of the 3 of us, and we'll be more than happy to help. Then the next poll we have is, so you've learned about all these ways that you can get involved. we have a few options about what you can do to get involved, and we'd like you to commit, and we'll reach out to you to make sure that you have all the resources to do that thing. So one of the options is visit your legislator. Even if you already have visited with them, you could visit with them again to express the importance of this issue. Writing a letter to the editor. And of course, we can always give you some guidance with that. We have a guide on our website that are tips to help get your letter to the editor printed. Maybe you have a story to share, or you know somebody who have a story to share of how they will benefit from Medicaid expansion. Or Deb talked about the house parties. Maybe you'd like to attend or maybe host a regional house party to get people educated and engaged in the issue in your area. Or to help attend or organize the regional rally happening in May 20th. Just click your answer. I'll give you a few more seconds to respond. And thank you for doing that. I'll share the results. Since you could click a multitude of those, we have some great responses. Looks like people really want to get engaged. I hope this webinar helped to express the importance of this issue and that it definitely is not dead. Don't be discouraged, and that it really is all hands on deck. So now we'll take some questions. We've got a few good ones in our red. So for more information, you can visit our Medicaid Expansion Center on the UHCAN Ohio website. There's a short link there. Also, if you want to stay up to date on what's happening, current events, news articles, things that UHCAN Ohio is doing, and lots of organizations across the state, you can like Ohioans Support Medicaid Expansion on Facebook. Also, if you'd like to join our email list, you can email ardillo@uchanohio.org. Or I have a quick poll. If you're not already receiving our emails, you can click yes on this poll, and we'll make sure to get you on our list right away so you can start receiving updates on what's happening with Medicaid expansion, since it's such a fast-moving issue and there's lots to do, lots of events coming up. Just click yes, and we'll make sure to get you on right away. Give you a few more seconds to answer that poll. Looks like a couple of you would like to be added. Thanks so much. And then finally, here is our contact information. You can reach Kathy, Deb, or I if you have any questions. Like us on Facebook, follow us on Twitter. Here are 2 websites for lots of information on Medicaid expansion and other healthcare reform issues we're working on. I'd just like to thank Kathy and Deb for taking time to present today, and then thank you to our over 20 participants who got on the phone today, took an hour out of their lunch to participate in this webinar. Kathy or Deb, is there any last words you'd like to say?
Out there, and if people need ideas for what they can do, we know how hard it is to go from inaction to action. We'd be happy to work with any individual who wants to start something up in your community. Deb, anything?
No, thanks for folks joining with us. And just to add to this storytelling, not only does it help move the issue forward, but as Kathy said, people walk away from it feeling empowered. So we just continue that concerted effort for helping folks share their story with us.
All right, thank you for joining us today. I'll be sending a follow-up email in the coming days with a PowerPoint and answer some questions with some resources that we had asked today. Thank you for joining us, and this concludes our webinar. Have a great day.